Good afternoon, everyone. It is a little bit after 3 o'clock on Wednesday afternoon. I have not provided you a briefing since June 30th of this year, and under the circumstances wanted to come back to you. I'm sorry that we have to do this, but we believe we do, and want to give you a bit of an update on where we are in COVID-related cases. And that's what I think I want to start with, and that is my goal here today, and our goal in the coming weeks is to provide you as much information as possible so that you can make choices in your own lives to provide for your health and the health of the people that you care for, that we can respond as a community to ensure that we're keeping people as safe as possible, and that you also understand the context within which decisions are being made. But at the heart of this, we certainly, after these last 20 plus months, know a lot more about this particular virus. We're still learning every day. We have some tools and weapons that we can use to slow the transmission, to protect public health. And while I certainly respect and support your right to choose to be vaccinated, I hope that you reach out to a medical professional, those that you trust, get some answers to questions that you may have, and just as I chose to be vaccinated, you might choose to do the same thing, and there are opportunities to do that. Very quickly, to jump right to our dashboard and data, you might have noticed we've updated the county's dashboard to include some of the data points that the CDC, the federal government, and the state government is using to make their recommendations known. We've tried to include some of that new data on the DuchessNY.gov COVID dashboard as well, so you have that information to make decisions as well. And you can see a little bit more, both real time and compare and contrast to where we've been, today's data compared to where we've been over the last 20 plus months. To provide broad context, let's look at the cumulative data. First, in this county, 846,188 COVID tests were completed to date. Now that's up from the 791,592 tests administered at the end of June when we last got together. To date, we have seen 30,929 confirmed cases. That is up from 29,508 at the end of June. And as much as we refer to these as data points and numbers, of course, we know that these are our friends and neighbors, loved ones who may have gotten a very minor case of the virus, weathered that storm, likely have a degree of antibodies as a result of that, and their bodies have responded to it. But we also know that some have experienced severe cases, and sadly, 458 of our friends and neighbors have lost their life to this virus. The current data that we have and the active information that we're monitoring now, Dutchess County is currently monitoring 726 active cases. That is, of course, up since the last time we were together. We had 56 active cases at the end of June. So when we were making choices at the end of June, and certainly wanting to get back to living as close to normal as possible, we were monitoring 56 active cases. We are now monitoring 726. The last week of June, just as a reference point, we saw between 1 and 4 new cases each day. Now, to be realistic, right? Some people were fatigued. No more testing. They didn't want to be tested. But the truth of the matter is, on any given day, we were seeing 1, 2, 3, 4 cases per day, new cases per day. Over the past week, we've seen anything in the range of 60 to 93 new cases a day. And again, from our perspective and a public health perspective, none of these data points individually would cause us to sound an alarm, but collectively we want to monitor those things. And so 60 to 93 cases a day means that among those cases there is the potential that some are more severe, and of those that are more severe, they'll seek and need hospital care. And that burden on the hospital care, on the hospital system, on the healthcare system, is what we've always, at least at this level, we've always been talking about and try to provide you that particular context. But 60 to 93 cases each day, and that is a pace that that is of concern to all of us in the public health world and in the healthcare world, and that's something that we obviously are monitoring. Today, we are at 4.8% positivity rate. Now remember, and I've said this a few times, and I think it's worth clarifying, we don't have a perfect tool to measure measure against on any given day the number of cases and its ability to transmit to someone else, right? This is not a transmission rate. This is a positivity rate. So we might have, so we take the total number of positive cases on any given day. We divide that by the total number of tests issued, and that gives us that positivity rate that we then measure over the course of 7 days and average out. Our current positivity rate is 4.8%. It's an imperfect data point, but it's the one that we use to kind of give us some indication as to where we are in this, ebb and flow, in this wave, if you will, of a virus. Are we at the bottom? Are we at the middle? Are we at the top and crest of a wave? Just as a reference point, at the end of June, we were at 0.28%, so nearly 0.3% transmission rate. We are now at 4.8%, and it's something that we obviously are concerned about and want to continue to monitor. We believe that we have the tools, and we encourage you to use those tools to slow the transmission of the virus. These are the data points. Currently, vaccination in the county continues to increase, but at a very slow rate. I encourage you, again, if you've not been vaccinated and you still have some questions that you'd like answered, please reach out to your healthcare professional, individuals that you trust, get the answers to the questions that you have, and I hope you might choose to be vaccinated. It is a tool that does work. Now that said, just as a reference point of the new cases, so between July 18th and August 14th, of those cases in that time period who were contacted and interviewed by contact tracers, so these are individuals that tested positive and chose to answer the phone, which gives me a moment to say that this isn't punitive. No one is using this to critique you. But if you get a call, answer the phone, even just to give that basic information, because the data that you provide, the information that you provide, helps us make choices. And we hope, by the way, can help us give educated information to you. So of those between July 18th and August 14th who were contacted, took the call, and answered some of the questions, 77% of those cases, those individuals were among individuals that were not vaccinated. 23% were among those who were vaccinated. Now, of the 28 individuals who are hospitalized at Dutchess County hospitals, that is up from just one. We had one hospitalization at the end of June. Why is this a concern? Well, the growth in hospitalizations is what puts pressure on the healthcare system. Why? You might say, and we've talked about this before, there are several hundred beds that might be available. That is true in the region. But keep in mind, not every room in every hospital is protected, if you will, in a way that would prevent an airborne virus, a virus that travels in the way that this does, to escape the room. So not every particular hospital room is built to contain an airborne virus of this kind. So, as those beds are occupied, the ones that do that are pressurized, that can control the spread of a virus like this, as those rooms fill up, hospitals have to use other rooms, and those rooms may close down. Use of those rooms may close down a whole wing or a whole floor. So those are the kinds of things that hospitals and healthcare providers have to be concerned about. I will be very candid with you. Our healthcare providers, our hospitals, with whom we're on calls every week, they have a level of concern about the transmission among individuals, visitors who have come into the hospital, visitors to staff. And then those staff members have to isolate, and those become big challenges for healthcare providers. So, 28 current hospitalizations. That's up from one at the end of June. On June 30th, we had one. 8 new hospitalizations this week. Now, of the 28 individuals that are hospitalized, 86% of those are unvaccinated. So we do know that those who are seeing more severe cases and are coming to a hospital setting are overwhelmingly not vaccinated. 458 individuals have succumbed to this virus. We've lost 458 of our neighbors, friends, family to this virus since we began monitoring COVID-19 in Dutchess County. That is up 12 from June 30th. On June 30th, we had 446 individuals who have succumbed to the virus. That has grown by 12, and in the last 10 days, 9 individuals have succumbed to the virus. Over the last 10 days, 9 Dutchess County residents have lost their life to the virus. Important to keep their families in our thoughts and prayers, and to recognize that those who are seeing that there are severe cases, and those severe cases are taking some lives. The vaccine metrics that we use, again, you can find it on our website. You can also monitor this data on the New York State vaccine information website. And again, this data comes to us from the state of New York. Currently, 72.1% of Dutchess County adults, so 72.1% of Dutchess County's adults have received at least their first vaccine. That's 182,491 of the nearly 295,000 residents who call Dutchess County home. That's 55.7% of Dutchess County residents have completed their entire vaccine series, or approximately 164,000 of Dutchess County's residents entirely have received their vaccines. So we encourage you to continue to choose to be vaccinated. I hope that you will. And again, I hope that you reach out to individuals who can help you answer the questions that you may have. It is your choice, and I hope that you conclude that it's in your best interest. But again, we encourage you to get the answers to the questions that you may have to make that decision. The county's health department, like other health departments in the state and across the country, updated and issued a public health alert that's available on the county's website. That public health alert is the Department of Behavioral and Community Health's responsibility to respond now to where we are with COVID-related numbers. It reiterates the CDC guidance. The CDC guidance is based on this county. I think 40 counties now in the state of New York all fall within the high transmission status. I also want to level set a little bit, just as a reference point. We are at a high transmission level. We have been at this point before. And there have been moments in time over the last 20 months, nearly 2 years, when even we were, returning to some semblance of normalcy, opening up activities, we still were in that high transmission rate. We're in a moderate transmission rate. The numbers fluctuate. They're also, the measurement tool is meant for every place in America. I only offer you that because, again, from a context perspective, we have been here before, and we may be here again. We hope not. But at this point, we fall within that high transmission rate status. So the Dutchess County Health Department, led by Commissioner Neil Wythian, issued their public health alert today, very similar to the alerts that have been issued by other counties and other public health departments across the region, across the state, and across America. The health department encourages you to be vaccinated. Again, we hope you choose to be vaccinated. Wear a mask in indoor public spaces. Wash your hands, personal hygiene, important, and practice that physical distancing when possible. The other, and I like to stress this one especially, if you're sick, don't interact with other people. I can't say this enough. I understand that you may not want to be vaccinated. You've chosen today, you're going to wait till the FDA gives full authorization. You may hold out for other particular reasons. Those are choices that you certainly can make. I understand that. We hope that you choose to be vaccinated. You may not support the idea of wearing a face covering or mask. I understand that. The health department encourages that we do that. I hope you choose to wash your hands at the very least. But the one thing you can do is if you're experiencing symptoms, please just choose to stay in, right? If you're symptomatic, you might think it's not COVID. We'll get the test just to be certain. And if it is, we want you to isolate because, again, in particular, symptomatic, right? But again, if you've tested positive and you're carrying the virus, you can transmit it to someone very easily. In particular, you might transmit it to somebody who isn't vaccinated, somebody who is vaccinated, and the severity of the cases has been on the incline. So please choose for your own health, the health of your loved ones and others, if you have tested positive, if you are symptomatic, to please stay in. I know it's tough with work and schools and what have you, but please stay in. Please try to be respectful of that as well. I will tell you, next week, we've had several questions about this. The Dutchess County Fair is moving forward next week. I know there are individuals that have varied opinions about that. We've monitored what happened at the Ulster County and the Orange County fairs. Right now, the Erie County Fair, which is actually the largest fair in the state, along with the New York State Fair, will be underway. The Erie County Fair is underway. The New York State Fair begins tomorrow, and we are monitoring the activities in those other places. We have monitored what we see as potential transmission concerns. We are, and the fairgrounds is encouraging in the indoor settings, certainly to follow the CDC guidance. The CDC guidance does suggest, even if you're outdoors in highly trafficked public places. So again, if you can't necessarily engage in some of that physical distancing, you may choose to wear a mask. It is the advice of public health providers. It's the advice of the county's health department as well, and we hope you consider that. The fair will go underway. The New York State Health Department is providing access to vaccinations at the fairgrounds. We don't expect, maybe you'll choose to do that there, but we're not expecting some major numbers, but it is an outlet, and just like Ulster County, I think at 27 or 30 vaccines administered over their 4 or 5 day period of their fair. The New York State Health Department is partnering with the county's health department to provide Pfizer vaccine shots at the Dutchess County Fairgrounds. They'll be available on Friday from 10 a.m. to 5 p.m. and on Saturday from 10 a.m. to 7 p.m. And again on Sunday from 10 a.m. to 5 p.m. And there'll be a tent located on the infield where the talent tent usually is. If you've been in the fair, you know where that is, and that's where the New York State Health Department will provide access to vaccinations. Now, our healthcare providers, our health department will be on site as well to provide information and to respond to questions. I'll also note to you that Think Differently Thursday is still underway. We encourage you to participate. The fairgrounds is open a little bit early, but on Thursday, but for the first half of the day until noon. Is it noon? Until noon, there'll be no lights, no sounds, loud noises turned down. So those of every ability have access to the fair. There will also be throughout the week Think Differently ambassadors available to you to answer questions and provide assistance, and a special cell-alone site for those who might need to get themselves oriented and kind of cool off and relax in a zone, in a space where it's much sensitive to sensory issues. So lastly, as you likely know, the FDA has approved and the CDC does recommend that individuals who are moderately to severely immunocompromised should receive an additional dose of the mRNA COVID-19 vaccine after you've received the initial 2 doses. So if you've completed your 2 doses, you must be 28 days from completing that vaccine. It is recommended, and the FDA has approved, a booster shot to individuals. A lot of reasons. We've talked about this. The interest for those who are immune compromised. The recommendation is to get that booster shot. Now, a couple questions have come up regarding the Johnson & Johnson versus the mRNA. A couple things. Johnson & Johnson is evaluating the efficacy of their shot against the variants, and there is the Delta variant, there are other variants, and there will be other variants. And because the Johnson & Johnson shot came out later in the cycle, right, later in the year, less body of evidence, less body of study. So Johnson & Johnson is conducting that analysis and may likely suggest booster shots, but that has not been determined yet. The FDA has not considered it or approved it, and Johnson & Johnson is still evaluating. The other is that because the mRNA shots began much earlier, if there was a need for a booster shot, of course you got that shot much earlier, it's possible that some of that, the benefit and the efficacy of that vaccine has shed, and therefore the booster shot is something that the FDA has approved and the CDC and healthcare providers are recommending right now for those who are immunocompromised. You may also say to yourself, well, why do I have to take booster shots? Think of it this way. You take a booster shot every year if you take a flu shot. The concept here is that, the shots themselves, and again, I'm not a doctor, I'm just giving you what we think is useful. The vaccine itself is meant to provide us a certain level of protection and encourage our body to build its own immunity. At some point, we hope, as a society, we've reached this concept of herd immunity. It doesn't mean that you'll never need a shot again. It means that, generally speaking, we as a society, we as a people can overcome the virus. The vaccine helps us get get there. A vaccine helps us get there. And in the case of the flu, for instance, we take that vaccine every year, booster shot every year, to remind our body to be on the lookout for a new strain or new strand of that particular virus. Again, things that I thought would be useful to share. As it relates to the third shot, vaccine access is widely available. Doctors' offices, pharmacies, and others have access to vaccines. So please first check with your area pharmacy, your physician, if you have one. It is likely the pharmacy will require a doctor's note to prove that you have some immune deficiency, that you're immunocompromised, and that you can access that third shot. So speak with your physician, speak with a pharmacy to schedule that third booster. If you are homebound and don't have access to a physician or a pharmacy, Dutchess County's Department of Behavioral and Community Health, our Office for the Aging, continue to provide homebound vaccines. So whether you're looking for that third shot or you'd like to get your first dose, we still have availability, and the county's departments continue to engage in homebound vaccinations. You can call us at 845-486-3555, 845-486-3555, and for more information, visit dutchessny.gov. There is some discussion currently for a booster shot, a third shot for all others. That is likely to be 8 months after you receive your second dose. So just as a reference, the current science, the current thought is that for everyone else, you might receive a booster shot 8 months after you've completed your vaccine rounds. And again, I kind of talked a little bit about why that may or may not become necessary. Again, your choice, but the FDA has not yet approved that, and the CDC is not yet recommending that for the general population. And the same is true with the Johnson & Johnson dose. We are awaiting their body of evidence to prove, disprove, support the concept of a booster shot. So what we're going to do is when we think it's appropriate, I'll come back to you live. We'll give you some updated information. As you have particular questions, please feel free to reach out to dutchessny.gov. Try to provide you with what information we can. Continue to look at our website for updated information as well. In the meantime, I just ask that you be a couple things I really encourage. Be safe, right? Be considerate of your health, the health of others. And again, if you're not feeling well, we want you to try to isolate yourself and be sensitive to the ability to transmit the vaccine. The county's health department, as our public health departments across the region, recommending adherence to the CDC guidance, the CDC recommendations. We encourage you to do that to be safe for yourself and for others. At the same time, please be respectful of each other. We don't all agree. In fact, I tell people often, this particular the debate over all of these questions occurs even in my own household, and my wife and I don't always see eye to eye on everything, but we live together. Well, the same is true for the rest of us. I understand government needs to be very respectful of your views, whether you have a degree of concern or you think government is overreached. We are to be responsive and respectful of all of you. That's our job. But as individuals, I just encourage us to be respectful in our dialogue and our debate and try to get to solutions that de-escalate the situation. But that being said, we encourage you to make the choices that are best for you. And in the meantime, ask you to be safe, stay healthy, and be kind to each other.